Hello, I will be doing a closure of median sternotomy with a FiberTape Sternal closure system. Our first step will include overlapping figure-of-8 sutures with the FiberTape, first beginning in the manubrium. I think it's really important to constantly maintain suture management, so pull the FiberTape through to appropriate location, and also to not pull by the needle, otherwise the needle will pop off. Again, I'm pulling the FiberTape through to reduce redundancy of the FiberTape. So I've now completed my first successful figure-of-8. I've maintained appropriate suture management. Now that I'm done, I can now pop off the needle. And then I like snapping it to the drapes, again, just for suture management. We will continue with the figure-of-8 sutures and work our way from the superior aspect of the sternotomy inferiorly. Again, I'm constantly maintaining appropriate tension on the FiberTapes. I'm not pulling from the wire. I think another really important and critical step right now is making sure that I haven't caught the previously placed FiberTape. And so what I'll do real quick is just give a little tug in both directions, ensuring that the previously placed FiberTape slides. Once I know I've not caught it, then I can complete the pass. Again, I'll pop off the needle and in a ordered fashion, snap it to the drape. Again, I'm just continuing along inferiorly, along the sternotomy. Now that the figure-of-8s have all been passed, it's critically important to manage all the redundancy of the FiberTape. And so, technique I like to use is just use a snap, make sure that the FiberTape is totally tight. It's just the snaps that we use at the bottom of the drape. Sequentially go back and do all this. And I'm just making sure that, again, all the redundancy has been removed. This really allows for a very tight closure. So we begin by passing the FiberTape through the nitinol loop and separating the orange loader. There's a preformed knot on the end of the FiberTape, and I continue to manage the redundancy of the FiberTape system, removing all extra slack, and then I re-snap it back to the drape. We will continue this in a coordinated fashion, again going through the nitinol loop. I'm using the snap to remove all the redundancy. Another technique that I really like to employ is getting this knot to slide all the way over. It's a really low profile knot. In my experience with the FiberTape sternal closure system, patients not only don't feel this, but you will not see a deformity. All of the pre-tied racking hitches have been set, and we are going to now move on to the step where the tensioner is utilized. So to begin, we have to set that hitch. I think a really important lesson I've also learned is making sure that the FiberTapes are not twisted, but they're completely in parallel with one another. Now with the tail of the FiberTape, I now pass it through the bottom eyelet of the tensioner. I then remove all the slack of the FiberTape and set the tensioning device down to the preformed hitch knot. Okay, so I've passed the tail of the FiberTape through the eyelet. I'm now going to pass the tail of the FiberTape through the hole of the ratcheting mechanism. I will then remove the slack of the FiberTape. With my thumb, I usually apply gentle tension downward towards the sternum. And now I'll begin ratcheting the FiberTape. In a controlled and reproducible fashion, I will now begin tightening. And you can see demonstrated here, the tensioner is not quite at 60. I have found in most cases the numeric value is typically between 60 and 80, but not always. I've now set my first FiberTape. I'm going to hand this to my assistant. I will continually set the FiberTapes, and that's a really nice closure. The sternum is totally reapproximated. The sternal edges, they're not off. I'm really happy with this closure. So now I'm ready to tie my knots. Now I'm going to activate the release button of the tensioner. As I activate the release lever on the tensioning device, I'm paying attention to the FiberTape here. Notice that the hitch knot is set. Now that we've set the racketing hitch knot and utilized the tensioner, I'm now going to cut the FiberTapes. I again ensure that there is an appropriate amount of tension, and I do alternating hitch knot ties, 3 of them total. I've now set the FiberTape. I've tied 3 alternating hitch knots, and see the very low profile of the knot. It's nice because it's in the intercostal space. Once that's done, I can now cut the FiberTape and move on to my next tape. I now am sequentially moving up from inferior to superior. I'm going to set the knot, and we're now moving on to the final fiber tape. I have it at a level that I'm really satisfied with. This, again, to highlight the tactile feedback. This chest is completely closed, very robust, sturdy closure. I think one of the huge and main advantages of the FiberTape system is, unlike traditional sternal closure devices, is in regards to emergent or ICU sternotomies. Obviously, this is a very rare event, but nonetheless happens. There is no need for a screwdriver. There is no need for a wire cutter. All we simply need is a scalpel, which is what is done to open the skin in the ICU, and we immediately have the fiber tapes exposed.